All right. So these learning outcomes are on the portal, so I'm not going to, as it relates to nursing. Federal law includes HIPAA, which was instigated or started in 1996. You guys know what HIPAA is, right? If you don't, at this point, then open this, make an appointment with me. Americans and Disabilities Act and the Patient Self-Determination Act. We'll talk about those two things in a minute. State law defines nursing practice, Nurse Practice Act, those varies by state. I highly recommend that you go to our State Board of Nursing, print out our Nurse Practice Act. I'm not going to test you over the exact Nurse Practice Act for our state, but I recommend it to print it out and read over it before you actually start as a nurse, okay? The state boards of nursing fall under state law. They can issue and revoke licenses, and they set standards for the nursing program. I'm going through this pretty quick, guys, because I want to get y'all out of here, but if I'm going too fast or if you have a question for me, raise your hand. So criminal law. These are offenses against the state. Criminal law includes felony, which is a serious crime, misdemeanor, less serious, and an example might be petty theft, and then juvenile, which is under 18. So can anyone give me an example of what they think an example of criminal law or a misdemeanor in nursing might involve? Anyone?
When restraints on somebody without order.
Say that again?
You still something that's not worth over.
Okay. Y'all speak up because I'm deaf and all. What y'all say?
Like when you restrain patients and stuff out order.
Stealing. We'll talk about restraints because that involves another type of law, but that was a good point. Someone who falsifies a record to cover up a serious mistake, that can be found guilty of criminal law. Okay. So very important to document correctly and objectively, and document truthfully. Civil law. This is more to do with the rights of an individual. A tort provides relief for people who have suffered harm from wrongful acts of others. The purpose is to compensate any victim for damages and discourages repeating behavior. So when you think of civil law, think of being civil to other people, and think about torts, okay? I really want to drive that home to you guys. That torts fall under civil law, and this has to do with the individual. Okay, so here I added a couple of things that's not on your slide. I just put a page number, page 46 in your ATI book. And then I also increased the elements to 5 instead of 4. And we'll go through that here, okay? So an examples of unintentional torts. Negligence. This is omission to do something that a reasonable person would do, or doing something that a reasonable person would not do. So negligence is not just skipping out on something. Negligence can include doing something that you know shouldn't be done. Okay? Does that make sense to you guys? 5 elements are required to prove negligence. Duty to provide care as defined by standard. So basically you have a duty to provide care to your patient, right? And you have standards to follow. That's through the Nurse Practice Act, that's through your institutional policies, but you have a duty to provide care. Breach of duty means that you failed to meet a standard. Foreseeability of harm. So this is the one that I added that you don't have. And it's also in your book, and there's some more explanation there on your book on page 46. But basically, if you are, as a nurse, understand that you need to provide a certain level of care, and you know that as a nurse and you've been trained to provide that care and you don't provide the care, that means that you knew ahead of time, you foresaw that you needed to provide that care, but you didn't do it, okay? Causation, defendant's actions were the cause of the harm. So we're looking at the cause, like what caused it to happen. And then an actual harm occurred. So if someone is being accused of negligence, those 5 elements will be reviewed in a case for negligence, okay? So examples of an unintentional tort in nursing. An example might be a nurse that fails to implement safety measures for a client who has been identified for at risk for falls. Does that make sense to you guys? So someone comes in the hospital, in the ER, and you know that they're a fall risk, but you don't identify that, okay? And you don't put it in their chart, and you don't give them a risk for falls wristband. So be very diligent to do the correct documentation, okay? All right. So we're still under civil law and unintentional torts. When you guys are studying, you need to look at the categories, okay? So you would start with civil law, and it would go down to unintentional tort, and then it would go down to malpractice. Y'all see what I'm saying here? So you need to tie these things together. So don't just look at malpractice, what is it? You're gonna look at, okay, where does malpractice fall? Okay, falls under civil law, unintentional torts. So malpractice is actually considered professional negligence. And there's a difference between just general negligence, because professional negligence is when someone who's been trained professionally is found negligent. It's the failure of a person with professional training to act in a reasonable way, and within their scope of practice. Very important. Okay. Examples: physician who operates without signed consent. Failure to follow the standard of care that results in injury or death. A nurse administers a large dose of medication that results in death due to a calculation error. So can you guys already see that you got lots of categories and lots of examples here, right? So if you're studying for this part of the exam, if I were you, I would make myself a lot of sample questions, mix up the examples, and see if I could figure out where they fall, okay? A lot of this is terminology. So again, with malpractice and professional negligence, they can avoid liability by doing the following. This is important for you guys because you want to be sure that you're never sued for malpractice. You follow the standards of care, give competent care, you communicate with other healthcare team members. I know some of you have had me in simulation, and I know some of you have heard me say, if you do a good assessment of your patient and you communicate with your team and your physician, you don't have to be as freaked out, okay? Because if you're assessing your patient, taking care of your patient, you know what's going on with your patient, and you're asking questions if you don't know, by communicating with your charge nurse and your team and your physician, you're gonna be covered, okay? You guys be good nurses, do good assessments, good thorough assessments, and don't skip out on that. You delegate appropriately, and you always follow up. It would be nice if everything we delegated as nurses could just always be done. And unfortunately, we have to be a little bit of micromanagers sometimes to make sure that everything's covered, okay? There's a nice way to do that. But be sure and make sure everything's been covered. Identify at-risk clients and maintain a safe environment. That goes back to fall risk. making sure you're documenting if, what's going on with the patient. Develop a good rapport with clients, and document precisely and accurately in a timely manner. One of the best things my preceptor at ICU South taught me when I first started as a nurse was how to document efficiently and quickly. So he basically would give me time increments. So when I first started in ICU, I was a little bit overwhelmed, you know, because you're learning all the things and everything's new. But one thing he told me, he was like, look, he said, you have to do a good assessment of your patient, but you should have this much documented by this time during the night. So he kind of gave me a guideline, and he said, sometimes you can't help it. Sometimes emergencies are happening, and you can't do that. But he gave me a standard to reach. So like, in order to get all of my documentation finished by the next morning, I'd work night shift, I would have a certain amount of documentation done by a certain time in the evening. Does that make sense? So set yourself some goals. That way you don't get too behind in your documentation. Okay? That was one of his best pieces of advice for me. Because we had experienced nurses that would be there documenting late. Like they would not do it the whole night, and then they would have to catch up in the morning, and then the charge nurse or the supervisor would come around and be like, you better wrap it up, because they didn't want to pay them overtime for being late on documentation. So stay on top of your documentation. Okay, so under civil law, another kind of tort is called quasi-intentional tort. Again, I'm going to just say this one more time. When you're studying the types of laws here, go back to the category that they fall under. Okay, so defamation or wrongful acts based on speech, that falls under civil law, quasi-intentional torts. I mean, that's a lot of words, but I want y'all to understand what kind of law it is, okay? Different types of defamation, I know you guys have heard of this before, but libel is actually written word or photographs, writing false statements. And slander is spoken word. So if you've ever wondered the difference, there it is right there for you guys. Libel is written, slander is spoken. Wrongful acts based on speech also include an invasion of privacy or confidentiality. So, if a nurse releases a medical diagnosis of a client to a member of the press, what would that be? What would that fall under? Invasion of privacy, breach of confidentiality.
False license.
Yes, exactly. What about if a nurse tells a coworker that she believes a client has been unfaithful to their spouse? Slander. Right. And then what about if a nurse documents in a record that the provider is incompetent? That's libel. So maybe the provider truly is incompetent, okay? But you can't write that in the chart. You can't say the provider is incompetent, okay? You can tell a story objectively, but you cannot just say this person is incompetent. Okay, does that make sense? Yeah. It's tempting sometimes. Okay, now we're going to civil law intentional torts. Somebody was talking about restraints earlier. So this is what that would fall under. Civil law, intentional tort. Restraints is under false imprisonment. That would mean you put restraints on a patient without a provider's order. Or for some reason, well, let me go back to that. Battery is when you actually are holding them down, a competent patient, against their will, okay? And then false imprisonment, again, is using restraints without an order. assault, threatening to do harm, this gets tricky, guys, because, you know, we've all had those patients, especially, in psych. If you've seen them, I said we've all had those patients, but you've seen it in clinical. It's tempting to make little threats if they won't do something, and you think it's innocent, but you have to be very careful with that. Something like, if you don't stop pushing the call light, I'm gonna sedate you. Well, that might be a joke to you, but that person may, write that down on a piece of paper and send it straight to the administrator. And then you're gonna be in trouble, okay? So be careful with how you joke. Y'all with me? All right, y'all are hanging in there pretty good. Okay, so I have a little Kahoot. Let's see if I can get to it. Especially through your institution, wherever you work, any kind of accrediting bodies like the Joint Commission, who develops the National Patient Safety Goals. I mentioned your institution or your healthcare facility, and then sometimes insurance can play some factors. Medicare, Medicaid, they need to play a role. So I have a question for you guys to think about. If the nurse practices according to institutional policy, and that standard of care, bless you, results in injury to the patient, is the nurse protected? What do y'all think?
No.
Yes. Does he follow their standard?
So, I'm not gonna, I read in our text that most of the time, if you are following the institutional policy for that standard of care, and it results in an injury, you will be protected, okay, by that institution. Now, if it goes against like a state, Nurse Practice Act, that might cause some problems. So, that's why it's so important for you guys to know your policies and procedures where you work. And if something violates the Nurse Practice Act, then you should bring it up and you should ask. Okay? You're gonna see a lot of imperfections out there in the nursing world, and I have confidence in you guys that y'all are going to make changes in the right direction. I think there are a lot of good things happening since COVID. Everybody got really tired and worn out with COVID. But I think people are, starting to ramp back up a bit and wanting to make changes for good. Okay, let's talk about standards of care. These define and direct the level of care that should be given by practicing nurses. And nurses should refuse to practice beyond their scope of practice. Okay, we talked about that before. You guys are good with understanding that, right? If you go to a new area and they expect you to do something or do some sort of skill, and you have never done it, you have no idea what's going on, you should say that's not in my scope of practice, I've never been taught this. And it's better for you to do that than just to go do something because you're worried about looking like incompetent. You're going to be incompetent if you do it without getting trained. So, always speak up and say, I'm sorry, this is not in my scope of practice, I need some training on this. Follow your chain of command to voice concerns. That's a big problem, I think, and truly it's a problem anywhere. But if you have a problem with your team, go through the right channels. Go to your supervisor. If your supervisor is not showing integrity, then you can go to someone above her or him or whatever. But use the chain of command, because what happens if you skip the chain, whoever you go to is going to be frustrated. So it's better to go through the chain of command, even if you don't think it's going to be worth it. It's better to go through the chain. Client rights. These are legal guarantees that clients have regarding their health care, and we are accountable for protecting their rights. That includes informed consent, refusal of treatment, advanced directives, confidentiality, information security. Okay, and we're gonna talk about those things in a little bit more detail here. So what is the nurse's role in client rights? It's important for us to make sure they understand their rights. Usually when patients are admitted to a hospital or a facility, they will be given a patient's bill of rights with all their paperwork. Now, you know, if you've ever been admitted, you know they give you like a stack of paper with like 20 things and you're never gonna look at it, but it should include a patient's bill of rights. The patient should understand that they have a right to be informed about their care. Competent adults should be able to accept, refuse, or request modification. So if a patient refuses treatment, I mean, it's our job to educate, but we are not to argue, okay? We can educate, but it's not arguing. We need to respect their decision. And patients have a right to receive care that's delivered by competent individuals. That's why we have to be confident in the care that we provide. Okay, let's talk a little bit about the Patient Self-Determination Act. This was mentioned at the very beginning of the lecture. This just means that competent adults have the right to refuse treatment. They have the right to refuse a procedure. And then we would ask them to sign a document stating that they understand the risk. Okay? So if someone says, I'm not doing this, then we have them sign like a form or a document that says that they understand that we've talked to them about the risk involved. If they leave a facility without orders, discharge orders, this is called AMA, or against medical advice. What is your job as the nurse when someone leaves AMA?
Make sure they know the risk.
Make sure they know the risk and notify the provider. That is a huge deal, okay? Yes, we need to make sure they understand the risk, but it's very important. Somebody might just get mad and walk out the door. And if they do, you notify the provider and you document objectively what happened. Okay? You document that you notified the provider. That is a huge deal to cover yourself. I have no idea what that is, but.
The trash can.
Okay. All right, should I shut that? Is that bothering you? It's just bothering me. All right. So, okay, what's the take home from this? You notify the provider and you document that you notify the provider. All right? You cover yourself by doing that. If the client refuses to sign the AMA form, you also document that they refuse to sign the AMA form. Do y'all see how this would be important? Like if someone were to follow up and look at documentation, why these things would be so critical, okay? All right. Advocacy. This is one of my favorite things about being a nurse. It's one of the hardest things, I think, most challenging things, is to advocate for your patient, to care, to emphasize autonomy, respect, empower the patient to make their own decisions, make sure they're informed, make sure that they're respected, and that they receive the proper level of care. I think I've told y'all many times, we stand in the gap for patients because we are in between their problem and the provider, and it's important. It's important for us to act as an advocate. A lot of hospitals have a patient advocate like office or a phone number that they can call. When my mom was in the hospital, I actually called the patient advocacy line. I truly lit up that line, just so you know. But it's important to advocate. We are their voice. We should also support and advocate for legislation that promotes policies that protect our clients. I think I told y'all, I used to be on the board for the Arkansas Center for Nursing. They're very involved with many different things around the state. They're a workforce, organization, but they also are involved with, any kind of laws that happen at our state capitol related to nurses. So if there's some law that's gonna be passed that, affects us as nurses or patients in the state of Arkansas, they are involved. You can be a member for free. I encourage you guys, when y'all graduate and get your license, to get involved with the Arkansas Center for Nursing. They do a lot of great things around the state. They help students, they provide some scholarships for students around the state, and just a lot of different things that they do that are great. They do 40 under 40, some of y'all have heard of that before. They recognize 40 nurses under 40 every year. And I used to grade the applications, and they're very steep. The competition is very steep, but it's really awesome. So I encourage you guys to get involved. All right. So when we're talking about informed consent, it's a little, there's some lines to be drawn between what the provider does and what the nurse does. So it's ultimately the responsibility of the healthcare provider to obtain informed consent, okay? They have to provide a complete description of the treatment or procedure, a description of who's gonna be performing the procedure, description of any possible harm that could come to them, options for other treatment, explain to them that they have the right to refuse treatment and any risks that are involved. These are the provider responsibilities. So the client gives informed consent. It must be given voluntarily. They must be competent and of a legal age, and they must have sufficient information to make a decision. And then here is where we talk about what is the nurse's job. So we witness informed consent, okay? We sign along with the patient, and we witness their informed consent. We make sure that the provider gave all the information, that the client understood it, that they're competent to understand it, and then we notify the provider if they don't understand. So an example would be if you have a patient that's going into surgery and maybe they don't speak a whole lot of English, the provider comes in English and explains the procedure and does all of the things that the provider should do. And then the provider leaves and the patient is there with the nurse and the patient says they don't understand. What do you do at that point?
Call the provider back and get a translator.
Yes, you could get an interpreter. Now, you can't use someone's brother or sister, okay? You have to actually have a professional interpreter. But then, what else might you do besides call an interpreter?
Call back the provider.
Call the provider back again, okay? Call the provider back and have him come speak to them again with the interpreter. Now, as nurses, we still do a lot of education, explaining, all that. But it really is the provider's responsibility to explain it and to explain informed consent and what's gonna happen to the patient. We are just there to witness it and help promote the activity. Does that make sense to you guys? Okay, all right, cool. We're getting there, guys. Implied consent. I'm not gonna take a break unless y'all tell me, so, y'all good? Okay. So this is when consent is an assumption. An example would be like if a nurse is gonna start an IV and the client holds their arm out. Basically, that's showing that they're willing to get an IV, right? That's an example of implied consent. Emergency consent is when the client is unable to give consent and there's no one there to sign for them. Basically, you have to follow policies and be very, very disciplined about your documentation and attempt to reach whoever is their contact person and document that you've tried to reach that person. Okay? Y'all cool with that? Written consent is required for an invasive procedure. You cannot just have implied consent for an invasive procedure. Okay? And you guys are responsible for knowing the laws in our state. Nobody's gonna be like, oh, we wanna make sure you understand all the laws, I mean, except for us, but you guys need to go look at the Nurse Practice Act and pay attention. Alright, so I'm gonna show y'all this, video real quick. I'm actually gonna start it 5 minutes into the video because I don't think we need to watch the whole thing. Some of y'all may have every single decision that you would have to make, and you can give it to, your family can give it to, like, your provider. I've done that for my family because I don't wanna ever have to make those decisions, but advance directives are really important because it, communicates the client's wishes regarding end of life. And it's asked of all clients in a healthcare facility. So when they're admitted to the hospital, that's one of the questions that they'll be asked is, do you have an advance directive? And if they do, they usually provide it at admission. Sometimes though, things fall through the loopholes, and especially patients in ICU, I remember many times having to ask, do you have a living will or an advance directive? And if they didn't, I would ask them to fill out that form, the 5 wishes. It's not an easy conversation to have with people, but very important. So the components of an advance directive include a living will, which is a document that instructs the family and healthcare providers about life-sustaining treatments. In my experience, just a standard living will doesn't really cover everything, and that's why I go back to that 5 wishes document. And the 5 wishes is not gonna be on your test, okay? I'm just letting y'all know. And then it also includes a durable power of attorney for healthcare. This designates another person to make decisions on your behalf, or on behalf of the client. So what is the nurse's role? You provide written information for them. You document their status, as far as what they have, as far as advance directives. You ensure that they're current. And you recognize the client's choice when there's conflict between family and the client or the provider. You really have to focus in on advocating for the patient, okay? You have to respect their choice. This gets really hard when the whole family is saying, we want them to, you know, we don't want them to be a DNR, we want them to do blah, 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 and the patient is saying, no, I don't want that. You have to respect the opinion of the choice of the patient. The nurse should also inform all the members of the healthcare team about the advance directive. All right, almost there, just a couple more slides. So this was part of your pre-simulation, your lecture prep assignments on ethical principles. I would highly recommend to you guys to understand the differences between these principles. Autonomy, you know, we can make a decision for ourselves. We have to, and nurses should respect that right. Non-maleficent, I can say it. No harm done. These words are weird to me. Beneficence. This is when we demand that good be done for others, and we provide competent care. Also, being an advocate falls under this category. Justice, you guys kind of pretty much know what that is, treating others equally. Fidelity, we hold true to our commitments, okay? When you see the word fidelity, just put commitment in parentheses next to it. Confidentiality, like HIPAA. Veracity means truth. Sometimes it's easy to get confused between fidelity and veracity. I would make a note of that in your head. fidelity, commitment, veracity is being truthful. And then accountability, accepting responsibilities for your own actions. All right? I have all the faith in the world in you guys that you guys are gonna practice these ethics. This is an example of the ANA's Code of Ethics for Nurses. I just wanted to show it to you guys because when I talked about how important it is for you to know your institutional policies, the nurses, the State Practice Act, the Nurse Practice Act for your state. These are examples of things that you should be aware of. The ANA's Code of Ethics is one of those things that's good to know. It's just good to understand what it means to be an ethical nurse. I'm not gonna read all of these provisions to you guys, but I would recommend just reading over them, okay? So dilemmas can arise, and you guys have seen it in your clinical, and you do your professional development, and probably have all seen some sort of ethical dilemma. It's important for us as nurses to get the facts, understand the psychosocial environment, and what the patient's wishes are. And then are there any conflicts in the ethical values that we talked about earlier? If it's too much for you to deal with as a nurse, sometimes it gets to be too much, okay? You're just trying to provide all the care, trying to talk to the patient, the family's arguing, maybe there's something going on and you just can't solve it. That's when you can call, tell your charge nurse and say, I have this problem, this dilemma, it may need to be solved by the ethics committee. And so they can reach out to that committee. So there's help for you there. If you feel like you can't get it solved, tell your charge nurse about it, and there's more resources available, okay? Because sometimes at the end of the day, I mean, you just can't be the person that tries to solve that problem for them, okay? So your process with ethical decision-making is you assess it, you plan, you determine the treatment goals, identify decisions that need to be made, you implement by helping all the parties come to a good decision, and then you evaluate if the desired outcomes were reached. Again, if they aren't, if people are still arguing and there's a lot of unrest and turmoil, you can reach out and to an ethics committee that can come help. Usually there'll be people like on standby that can come help. Sometimes they'll send a member of the committee, or they'll send pastoral care. They'll send somebody who can kind of help negotiate.